Joining Morning Rush is Dr. Amesh Adalja, an infectious disease doctor working on pandemic policy. He's also a senior scholar at the Johns Hopkins University Center for Health Security. Doctor, thank you so much for your time. I want to start with this. Was it too premature to end this mask mandate on public transportation?
No, I don't think so. What we're talking about is really a 2-week difference from when the Biden administration had set this to expire versus what this judge decided. And I think when you look at the world and what people do now without wearing a mask or where masks are optional, and then you kind of go to the transportation world, it really made no sense to have this discrepancy, at least in my mind, especially on places like airplanes where the air cycling is so fast that it's almost, it's very, very difficult to actually contract COVID-19 on an airplane. It's one of the safest places that you are from COVID-19. So I think this was something that was bound to happen, whether by a judge or whether by the Biden administration itself. And I think what we now need to do is really get people to think about individual risk calculation and deciding what level of protection they desire and making that decision, since we all have access to high quality masks if we choose to use them.
Right. And just last week, as you mentioned before, the CDC recommended May 3rd. Obviously, things have changed this week. So there's kind of a mix in messaging here and who we should go to for our information. And, we're seeing this surge in cases in some parts of the country. So how does this mixed messaging on protection impact the spread of the current subvariant, which we know is a bit more contagious than the Omicron variant?
Well, we know that the BA2 variant is going to spread and the cases weren't inevitably going to go down forever, that we will likely see some increase in cases. But when you're talking about a virus that can't be eradicated, that can't be eliminated, that's going to become endemic, cases become less important, especially when they're decoupled from hospitalization. So what I think is more important, and this is what the CDC has been looking at when they make their masking guidance for communities, is hospital capacity. And what we see is this delinkage. Cases are not landing in the hospital because they're happening in people who are vaccinated or have prior immunity or get antivirals or get monoclonal antibodies. I worked all day yesterday in a hospital and saw 0 COVID patients. That's increasingly becoming the norm as this shifts to an outpatient illness, one that's more tame. And I think that means that we can start to think about this like other respiratory viruses. And that's the message we have to get to people, is how to individually risk calculate, knowing COVID risk is always going to be greater than 0, but it's going to be a much more manageable infection. And that's always been the goal with this virus.
Some cities are starting to try to get ahead of this new surge. Philadelphia already reimposing the mandates. New York City is also on the verge of raising its COVID risk alert from low to medium. What is your advice for these cities? Do you go with reimposing the mask mandates, or is it too late for that? Is the toothpaste out of the bottle, so to speak?
I wouldn't reimpose mask mandates. I don't think, again, as I said before, that cases are what matters. You can't continue to look at cases with a virus that's going to ebb and flow and have hotspots that pop up, especially with a more contagious variant. What you have to look at is hospital capacity. And when you look at New York City, for example, or even Philadelphia, where they've instituted a mask mandate, their hospitals are not feeling pressure. So I don't think that this is a justified action by the governments of those cities. I think what you have to think about is when making recommendations for high-risk people to wear masks and giving people the tools to be able to make those decisions rather than making it a government edict. I think what we've seen is that masks and many other COVID countermeasures have been completely politicized. And I think we have to get back to bread and butter public health, which is voluntary recommendations, because we're in a different place with this virus and we're not seeing our hospitals be overrun.
Is there any concern, though, that with these mask mandates being pulled back in different major cities like Philadelphia and now on airplanes, that there's just going to be mass confusion? I mean, when we get to places, let's say somebody is flying from Florida, for example, to Philadelphia. I mean, it's very different there than it is in Florida. So is there going to be this mass confusion on what you should do, what you can do?
There's definitely going to be a patchwork of policy, and that's what we've sort of seen through this pandemic. For example, Florida has been that way since the very beginning of the pandemic. Different rules apply to different states. That's increasingly going to be the case, but eventually, hopefully, we'll get to a point where all the states are on board with a kind of harm reduction way of dealing with COVID-19 rather than mandates, and they're giving people guidance on how to operate. But I think it is going to be confusing for some time for people to know what the rules are in a given state or even in a given country or a given venue. But I think that's kind of where we are, and I think people are going to have to find a way to navigate through it, and I think it's doable.
When I first heard about this judge, the judge's ruling about lifting this mask mandate, my first thought was elderly people and people with compromised immune systems,
or babies
who aren't vaccinated, who may be a little nervous about getting on a flight right now. You were earlier talking about how they're lower at risk being on planes. To my knowledge, there are no outbreaks linked to them. What message would you have for an elderly person or a person with compromised immune systems who is worried about getting on a plane?
Well, first off, remember that one-way masking works. When I take care of patients with tuberculosis or other airborne infections, I wear an N95 mask myself. The patient's not wearing a mask. One-way masking works. And it's important to remember that just because the government says you don't have to wear a mask on a plane doesn't mean that you're forbidden from doing so. So if you are someone that's at high risk and you're worried about your risk in a given venue, wear a mask. We all have access now to N95s or N95 equivalents. You can continue to wear that mask and it will protect you. That's what I recommend to people. And also just remember that airplanes do have a lot of air recycling air cycling that happens. The exchanges of air on an airplane are probably much higher than anything else that you're doing in your day-to-day life where you might not be wearing a mask. I think there's been a lot of inflation of the risk on airplanes that really wasn't justified by the science.
Very valuable insight there. Dr. Amesh Adalja, always good to see you. We appreciate it.
Thanks.